Bronchitis. Normal physiology of the respiratory tract. Air is inhaled through the nose and mouth and then passes through the pharynx, larynx, and epiglottis. The air then continues down the trachea, which divides into two bronchi, the left and the right. The air then travels through smaller bronchi and bronchioles. The bronchi are divided into three subdivisions, the main, lobar, and segmental sections. The air then travels into the alveoli, where gas exchange of oxygen and carbon dioxide occurs. In normal gas exchange, the partial pressure of oxygen in the alveoli is 104 millimeters of mercury, and the carbon dioxide is 40 millimeters of mercury. This is when sufficient amounts of carbon dioxide is being exhaled and oxygen is being inhaled. The trachea is lined with cilia to collect dust, and the smaller bronchi have fewer goblet cells and cilia. Therefore, they need macrophages in the tissues for protection. The definition of bronchitis is inflammation of the mucous membranes of the bronchial tubes in the lungs.
Bronchitis can be found in its acute or chronic form. Acute bronchitis is a common illness that causes an infection in the upper respiratory tract. The infection causes a cough that lasts more than 5 to 10 days. It is usually caused by a virus or a cold and flu. Chronic bronchitis is distinguished by having a chronic cough for 3 months of the last 2 years, and if continues, develops into COPD, chronic obstructive pulmonary disease. Several irritants, such as cold and flu viruses, air pollution and environmental factors, dust, toxic gases, smoking, can cause bronchitis. These irritants cause the mucous membranes of the bronchi to swell and secrete excess mucus in an attempt to remove the irritants. Normally, the number of goblet mucus-secreting cells cover less than 40% of the area of the lining of the bronchial tubes, but prolonged irritation can cause the goblet cells to proliferate, which increases the area in which the goblet cells cover to over 50%. Because of the excessive mucus production and chronic swelling, the cilia become damaged and mucus cannot be removed efficiently. It then becomes fibrous and obstructs the airway, impairing ventilation. Because of this, infection often occurs in the bronchioles because of the mucus pooling and being thriving environment for bacteria.
Few symptoms of bronchitis are wheezing, decreased exercise tolerance, hacking, chest or shoulder pain, production of mucus, which can be clear, white, yellow, or green in color. Chronic bronchitis can cause respiratory acidosis. Respiratory acidosis is a condition that occurs when the lungs cannot remove all the carbon dioxide the body produces. This causes body fluids, especially the blood, to become too acidic. Bronchitis also leads to the production of more goblet cells in the lower airways and overproduction of mucus. This mucus becomes so thick that it makes the cilia ineffective. This makes the lungs more prone to infections like pneumonia. The inflammatory pathway is also triggered because of the irritants in the lungs.
Proteins. As bronchitis progresses, the elastic fibers that surround the bronchioles become fibrous and stiff, which makes it difficult for the bronchioles to expand and contract while breathing. When an infection is present, our body stimulates proteins in the liver and blood to become activated and produces acute phase proteins, which work with the inflammatory pathway. Cell membranes. The cell walls of the bronchial cells that are exposed to irritants become more permeable. This causes the swelling and fluid to move from the ECF to the ICF.
In summary, chronic bronchitis is a form of chronic obstructive pulmonary disease that causes the overproduction of mucus in the lower airways and also hardens the elastic fibers surrounding the bronchial tubes, which in turn makes it more difficult for the bronchial tubes to expand and contract. The excess mucus becomes viscous and is unable to be cleared from the lungs. These pools of mucus become breeding grounds for bacteria, causing pneumonia and other respiratory infections.